Hi, Dr. Lewis here, wondering about what medications you are currently taking. Why do we ask that question? Because medications are prescribed to treat diseases or at least symptoms of those diseases. So now we have an idea of what diseases your doctor or doctors have determined you may be suffering from. The issue with most medications is they manage symptoms. They don't really treat root cause. Antibiotics are somewhat demonized, but they actually treat root cause, bacterial infection. But here's the other issue with medications. Drug companies spend about $5 billion plus or minus to approve a medication, and U.S. patent law does not allow them to patent natural substances. So the only thing they can patent and then market with any kind of profitability are synthetic substances. I'm a chemist, and so I know that the dose makes the poison, but most synthetic substances have toxicity. But we really have an American conundrum. And take a look at this chart. This is a listing of the 26 most developed nations looking at life expectancy in years versus healthcare spending. And you can see compared to most of the countries that we consider really developed, Japan, Spain, Korea, Sweden, France, countries like that, that we're living 2 to 3 or even 4 years shorter, but we're paying 2.5 times more for health care. A lot of that has to do with procedures, but in the pain market, for example, we use 10 times more pharmaceuticals for pain than any other nation, and between 2 and 5 times more in medications in general. So we really are a heavily medicated society compared to those that live a lot longer. So I call it an American conundrum, and what America says is the more we spend on healthcare, the shorter we live. A little bit funny, but sometimes, there's a sad truth to the accuracy of this chart, actually. So here's from Pharmaceutical Technology, drug side effects, Big Pharma's inconvenient truth. And this is some basic statistics on pharmaceuticals. And I encourage you to take pharmaceuticals if you really, really need them to manage intolerable symptoms or to cure or reverse conditions. But there are other methodologies. Most of the major diseases are lifestyle related, so let's work on that. So some 100,000 people in the U.S. die from prescription drug side effects every year. 7% of all hospital admissions in the country are due to adverse drug reactions. I was surprised when I saw that's a huge number. And lastly, they're costing the healthcare system through these admissions and morbidity, which is disease caused by these things, side effects, $150 billion. So what medications are you currently taking? It tells us a lot. In surveys I've done, the number one thing people want to do to improve their health is actually get off their medications. Yes, reduce chronic pain and fatigue, but people want to get off their medications. I hope you found this presentation enlightening. Thank you very much.